Hello. This presentation describes psychological stress-induced bladder overactivity in female mice is associated with enhanced afferent nerve activity at low bladder pressures. This work was completed at the Centre for Urology Research, Bond University, Australia. This work was supported by a grant from the Australian Bladder Foundation, managed by the Continence Foundation of Australia. Psychological stressors are actual or perceived threats to well-being that tax or exceed our capacity to cope, and can include many things from the chronic daily pressures of life to a single severe traumatic event. It is well established that stress can affect our health, with an abundance of clinical literature indicating that stress is linked to bladder dysfunction, such as overactive bladder and interstitial cystitis, with patients in these cohorts reporting higher stress levels than healthy controls. Stress has been shown to play a role in the development of bladder symptoms or worsening of symptom severity. Stress has been shown in other organ systems to affect afferent nerve activity, such as in the gastrointestinal tract. However, this has not yet been investigated in the urinary system. Therefore, our aim was to investigate the effects of psychological stress on bladder afferent nerve activity. To achieve these aims, adult female mice were randomly allocated to an unstressed control group or a stressed group. Mice in the stressed group were placed individually on a central pedestal surrounded by water for 1 hour per day for 10 consecutive days for a water avoidance stress exposure protocol. They were then returned to their normal housing. The control unstressed group consisted of age-matched control mice housed under normal conditions. Voiding pattern analysis was performed before and after day 10 stress protocol to confirm development of bladder overactivity in stressed mice reported in previous studies. The pelvic region of the mouse was dissected and placed in a bath containing warmed Krebs. A urethral catheter was inserted to allow filling of the bladder, and a dome catheter inserted to allow measurement of intravesical pressure and emptying. Bladder afferent nerves were divided into fine branches and one branch inserted into a suction electrode. The afferent nerve activity in response to bladder filling was measured using Spike-2 software. Confirming the stress-induced voiding dysfunction reported in previous research studies, on day 10 of the stress protocol, there was a significant increase in voiding frequency, as could be seen here in Figure A. There was no corresponding change in urine production, indicating that the increased voiding frequency was indicative of an overactive voiding phenotype and not increased urine output. Unstressed control animals showed no change in voiding behavior over the course of the study. This is an example of the pressure trace we get when filling the bladder. Mice will void when the pressure reaches approximately 15 millimeters of mercury. We fill past this to look at the effects of noxious stimuli. The relationship between volume and pressure can be plotted to measure bladder compliance. As we can see here, both groups had a similar volume-pressure relationship, indicating that stress did not affect bladder compliance. As bladder pressure increases, the afferent nerve activity also increases, and this is an example of the nerve activity trace during bladder filling. We then represent the afferent activity as the number of impulses per second at each pressure increment up to 40 millimeters of mercury. This graph shows that at the lower physiological pressures, the stressed group had higher afferent activity than the controls, while in the higher noxious pressure ranges, afferent nerve activity was decreased after stress. Next, we use single unit analysis to identify each individual nerve fiber that was contributing to the total nerve activity during the experiment. The analysis showed that stress did not affect the number of individual fibers. Bladder afferents contain a portion of silent fibers that are not normally active, but can become active in response to inflammation or other noxious stimuli. So this suggests that stress does not cause activation of silent fibers. Fibers can also be classified according to their activation threshold. Low threshold nerves start firing shortly after bladder filling begins, whereas the high threshold nerves become active at around 15 millimeters of mercury. The activation thresholds for the nerves can be lowered by various mechanisms. However, stress did not significantly affect the number of low threshold or high threshold fibers, suggesting that stress does not alter activation thresholds of bladder afferents. The activity of low and high threshold nerves was then measured. The low threshold nerves responsible for filling sensations were significantly more active in stressed animals at low pressure. At high pressure points, above 35 millimeters of mercury, the low threshold nerves in stressed animals were significantly less active than controls. The high threshold nerves responsible for pain sensations were more active in the stressed animals than in control animals across all pressure points. In conclusion, water avoidance stress in adult female mice is associated with increased afferent activity at low bladder pressures that correspond to the bladder pressure typically seen during bladder filling and emptying. Both low and high threshold nerves demonstrated increased nerve activity, suggesting that stressed animals may experience enhanced bladder filling sensations as well as bladder pain sensations. The number of single nerve fibers and the ratio of low to high fibers contributing to the nerve responses was similar between bladders of stressed and control animals, indicating that stress did not activate silent fibers, nor did it change the activation threshold of the nerves. The takeaway message from this work is that psychological stress appears to increase the inherent excitability of the individual nerve fibers, leading to bladder overactivity.